Hi friends, welcome back to our channel 10x Health and Nutrition. Today we talk about in this video fatty liver symptoms, cases and natural support strategies. How we protect a liver? What are the major functions of liver? What cases of fatty liver? So let's continue the details. Fatty liver, symptoms, cases and natural support strategies. The liver is your body's workhorse. It performs many functions including converting food to fuel, filtering harmful toxins, making proteins that help blood clot, and producing bile. Unfortunately, this powerful organ is susceptible to a potentially dangerous condition called fatty liver disease. Fatty liver disease occurs when fat builds up in the liver. It can be caused by drinking too much alcohol, but people who do not consume alcohol can also get the disease. When fatty liver disease is caused by factors other than alcohol, it is called non-alcoholic fatty liver disease or NAFLD. Fatty liver is caused by the accumulation of excess fat in liver cells in the form of triglycerides. If left untreated, fatty liver can increase the risk of cirrhosis and liver cancer. Fatty liver can occur at any age, but is most common in people ranging from 40 to 50 years and older. As a slower metabolism occurs as part of aging, risk obesity, high blood pressure, high triglyceride levels, then high blood cholesterol. Cases: alcoholic fatty liver disease, non-alcoholic fatty liver disease. Symptoms: fatty liver can be a silent killer because the progression of the disease is very gradual. Most patients experience little to no symptoms, leaving them unaware of their condition until it's critical. When inflammation of the liver occurs, patients can experience feeling of exhaustion. About 10 to 20% of fatty liver patients develop hepatitis, which increases the risk of cirrhosis and liver cancer. Treatment: safe and gradual weight loss through improved weight and exercise. To reduce fatty liver, it is necessary to lose 5 to 10% of total body weight and about 10% to reduce liver inflammation. It is very important to change eating habits to reduce carbohydrates, fats, and sugars, and adding more fruits and vegetables. Control risk factors by reducing high blood cholesterol, diabetes, and high blood pressure to be at the healthy level. Avoid alcohol consumption. Avoid medication or food supplements other than those prescribed by your doctor. Have an annual checkup. Then diagnosis, ultrasound diagnosis, other tests such as X-ray, MRI, and fibroscan, then medical history review and liver liver biopsy for pathology. Can fatty liver be healed? There are many case reports of people healing fatty liver disease. At this time, there are no FDA approved treatments that prevent, mitigate, treat, or cure fatty liver disease. But there are many natural support strategies that can support liver health. One of the most important strategies is following an anti-inflammatory healing diet using ketogenic guidelines. You should include food and herbs that support liver health in this diet. Other support strategies for the liver are intermittent fasting, drinking plenty of water, reducing stress and improving sleep, dealing with your anger, using Epsom salt baths and castor oil packs, and adding liver supporting nutrients, improving gut health, supporting stomach acid levels, and optimizing bile flow are all important for liver health. Why do we need liver protection? Daily life overloads the liver, leading to poor health and disease. Coffee and energy drinks, poor nutrition, poor eating habits, soil deficient in key detox minerals, allergies, food intolerance, prescription and OTC medicines, alcohol intake, processed foods, sugar and white flour products, environmental toxins, heavy metal, pesticides, smoking, stress, excessive workload, acute or chronic infection or illness. Fatty liver disease, also known as hepatic steatosis, can often be managed and, in many cases, reversed with appropriate lifestyle changes and medical intervention. The possibility of healing depends on the type and severity of the condition. Non-alcoholic fatty liver disease, NAFLD. This is the most common type and can often be reversed, especially in its early stage. Key steps include weight loss. Losing weight can significantly reduce liver fat. A gradual weight loss of 5 to 10% of body weight can improve liver health. Healthy diet. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help reducing sugar, refine, reducing sugar, refined carbohydrates, and saturated fats is important. Regular exercise. Physical activity can help reduce liver fat. Controlling blood sugar and cholesterol. Managing conditions like diabetes and high cholesterol can also be beneficial. Alcohol, alcoholic fatty liver disease, AFLD. This condition is caused by excessive alcohol consumption. Stopping alcohol intake is crucial for healing. Depending on the damage, the liver may recover partially or fully over time. Non-alcoholic steatohepatitis, NASH. This is a more severe form of NAFLD, where inflammation and liver cell damage occur. Lifestyle changes are essential, and in some cases, medications or other treatments may be needed to manage the condition and prevent progression. Cirrhosis. In advanced stages, fatty liver disease can lead to cirrhosis, where liver damage becomes irreversible. However, lifestyle changes can help manage symptoms and prevent further damage. Consulting a healthcare provider for a proper diagnosis and personalized treatment plan is important. Why is the healthy liver so important? The liver is your largest internal organ and one of the most important organs in your body. The liver is the body's workhorse, performing many critical functions. Detoxification is one of the liver's most important functions. The liver is referred to as the gatekeeper or a defense system because it absorbs the filters everything we put into our bodies. After filtering, the liver clear harmful toxins and waste while retaining the nutrients the body needed. These nutrients are then converted by the liver into essential blood components and released when needed. Metabolizing fats, carbohydrates, and protein and balancing hormones are other functions performed by the liver. The liver helps oxidize triglycerides to produce energy. It also produces bile, which is essential for digesting and absorbing fats in our diet. The liver ensures blood sugar levels remain constant by removing and storing sugar. If blood sugar levels increase and releasing sugar when blood sugar is low. It also converts amino acids in protein for energy production and removes ammonia produced in the process. By removing pathogens and fighting infections, the liver supports your immune system. It also regulates and directs hormones to perform their proper function. Which these many functions, it is critical to protect the liver from disease. The major liver functions helps your body fight infection by removing bacteria from the blood, prevents storage of nutrients by storing vitamins, minerals, and sugars, creates ketone bodies for cellular energy production, produces most protein needed by the body, produces most of the substance that regulate blood clotting, creates cholesterol for hormone production and tissue healing, removes potentially toxic substance we consume from the environment, such as estrogens, pesticides, herbicides, and medication byproducts. Produces bile is a compound needed to digest the fat and absorb vitamins A, D, E, and K. This is all about in this topic. If you want to learn more or stay healthy lifestyle, visit our channel, see more videos, or contact us. Thanks for watching this video.